Welcome. Today we're going to explore something profoundly human, yet often misunderstood: anger. We've all felt it. That surge of heat, the quickening pulse, a knot in the stomach. While anger is a universal emotion, a natural part of our human experience, for some it becomes a powerful, disruptive force, affecting their well-being, their relationships, and even their health. Perhaps you've found yourself struggling with anger that feels too frequent, too intense, or just too difficult to control. Maybe you've seen its negative impact ripple through your life, affecting your job, your friendships, or your family. If so, you're not alone, and importantly, there is effective help available. Today, we're delving into the evidence behind anger treatment, what the science says works, why this field is constantly evolving, and how understanding these insights can empower you or someone you care about to navigate this powerful emotion more constructively. Our goal isn't to eliminate anger, but to understand it, manage it, and channel it in healthier ways. Let's begin by truly understanding what problematic anger looks like. Physiologically, anger is a normal biological response. Your heart rate goes up, blood pressure rises, and stress hormones flood your system. It's often triggered by a perceived threat, a sense of injustice, or a loss of control. In small doses, it can even serve a protective function, motivating us to address problems. However, when anger becomes uncontrolled, when its frequency, intensity, or destructive expression spirals, the consequences can be severe. We're talking about job loss, broken relationships, legal troubles, and a real toll on physical health. Chronic high blood pressure, heart disease, and digestive disorders can all be linked to persistent, unmanaged anger. The primary goals of treatment, then, are clear: to reduce that intense emotional and physiological arousal, to help you pinpoint your personal triggers, challenge unhelpful thought patterns, develop healthy coping mechanisms like relaxation techniques, and foster assertive, respectful communication. This field of anger treatment isn't static. It's a dynamic area of continuous evolution and research. Why? Well, for one, clearly defining and measuring problematic anger versus normal anger is a persistent challenge. Researchers are also constantly comparing different therapeutic approaches to see what works best for whom, and we're always learning more about anger's complex interplay with underlying mental health conditions like depression, anxiety, or trauma. On top of that, cutting-edge research is exploring the neurological underpinnings of anger and even developing innovative delivery methods like game-based therapies to reach people in new ways. It's a truly fascinating landscape of inquiry and development. Now, let's talk about what the evidence actually tells us. Psychological treatments for anger have shown significant effectiveness. Multiple studies and meta-analyses, which combine data from many different research papers, suggest that approximately 75% of individuals who undergo anger management therapy show improvement. This isn't just a slight shift, it indicates a moderate to strong level of efficacy, meaning these treatments genuinely make a difference. At the forefront of these evidence-based approaches is cognitive behavioral therapy, or CBT. This is widely recognized and the most extensively researched. CBT helps you identify and modify those maladaptive thoughts and beliefs that often fuel your anger. You learn to understand your triggers and develop alternative, healthier responses. Techniques like stress inoculation, which teaches you how to prepare for and cope with stressful situations, are common here. Researchers like Dr. Raymond W. Novaco and Dr. Raymond de Giuseppe have made significant contributions to our understanding and application of CBT for anger. A form of CBT, Dialectical Behavioral Therapy, or DBT, is particularly effective for very intense anger. It focuses on critical skills like emotional regulation, distress tolerance, mindfulness, and improving interpersonal effectiveness, basically how you interact with others. Then there's relaxation training. This teaches practical techniques such as deep breathing, progressive muscle relaxation, mindfulness meditation, and guided imagery. These are powerful tools for reducing that physiological arousal we talked about, calming your body when anger starts to build. Skills training is another vital component, equipping you with specific tools for navigating challenging situations and managing stress before it escalates into anger. This could be anything from communication strategies to problem-solving techniques. For anger that impacts family dynamics, family therapy addresses these issues within the entire family system, aiming to improve communication and resolve underlying conflicts that contribute to anger. Sometimes anger has deeper roots. Psychodynamic therapy explores these underlying psychological origins and habitual responses, offering insights that can complement other anger management strategies. And finally, acceptance and commitment therapy, or ACT, encourages you to accept difficult emotions and thoughts rather than fighting them, while committing to actions that align with your core values. It's about making space for feelings and choosing how to respond.
The progress in this field wouldn't be possible without the dedicated work of many researchers and clinicians. Beyond those I've mentioned, people like Dr. Charles Spielberger have been instrumental in defining and measuring anger. At institutions like the Beck Institute, Dr. Norman Cotterell continues to advance CBT, and for innovative approaches, we see researchers like Dr. Joseph Gonzalez-Heydrich at Harvard Medical School involved in developing game-based therapies like rage control to engage individuals, especially younger ones, in managing anger and aggression. The American Psychological Association, along with major academic and medical centers, remains central to this ongoing research and treatment development. Despite these advancements, the field isn't without its debates and evolving discussions. One key challenge, as I touched upon earlier, is simply defining and measuring problematic anger. When is anger a normal response, and when does it cross the line? It's often conflated with aggression or hostility, which complicates both assessment and treatment evaluation. Another area of ongoing discussion is the comparative effectiveness of various therapies. While CBT is well established, we need more research to understand which specific modalities work best for different individuals and anger profiles, and whether individual versus group therapy makes a difference. A significant public misconception we must address is the venting myth. Many people still believe that aggressively venting anger is healthy, that it's a necessary release. Research strongly refutes this. Aggressive venting often escalates anger, making it worse rather than better. On the flip side, suppressing anger entirely can also have negative health outcomes. The key, as we've learned, is constructive expression. There's also ongoing debate about whether anger is a standalone primary disorder or often a symptom of underlying mental health conditions, such as depression, anxiety, personality disorders, or past trauma. Understanding these co-occurring conditions is absolutely vital for integrated and effective treatment. Some arguments also highlight that focusing solely on individual anger management can overlook broader societal and systemic factors that contribute to anger, things like economic disparities or social injustices. This encourages us to consider protest anger as a valid response to structural issues, suggesting a need to address these larger contexts alongside individual interventions.
So, what does the future hold for anger treatment? I believe we'll see the development of clearer, more precise diagnostic and assessment tools, allowing us to better identify and understand problematic anger. There will be a continued emphasis on robust comparative studies, helping us fine-tune which treatment modalities are most effective for specific populations and anger profiles. Integrating our deepening understanding of neurological underpinnings into clinical practice promises more mechanistically targeted treatments, potentially leading to highly personalized interventions. Furthermore, future approaches will likely consider and address broader systemic factors that contribute to anger, working hand in hand with individual therapeutic interventions. And those innovations in delivery, like game-based behavioral therapy, represent a truly promising frontier for engaging individuals in anger management in accessible and compelling ways. In conclusion, while anger is a powerful and complex emotion, the evidence clearly shows that effective treatments exist. The field of anger management is a vibrant, evolving area, continually striving to offer better tools and understanding. If anger feels like it's controlling your life, or if you're struggling to express it constructively, please know that you don't have to navigate it alone. Seeking out evidence-based therapy from qualified professionals can provide you with the strategies, insights, and support needed to transform that destructive fire into a constructive force, leading to a healthier, more balanced life. The journey towards understanding and managing anger is a journey towards greater well-being, and it's one well worth taking.